For many Australian men, feeling constantly tired or not themselves is a daily struggle. What if the definition of low testosterone depends entirely on which doctor you see? Your symptoms, low energy, poor sleep, low sex drive, could be dismissed by one but treated by another. This isn't just about numbers, it's about your quality of life and getting proper medical care. We'll show you who is truly eligible, the real benefits, serious risks, and how the system works. First, what are the signs? Low testosterone isn't just fatigue. It can be erectile dysfunction, less body hair, and loss of muscle and bone mass. If those symptoms are familiar, a clinical diagnosis is next. In Australia, this means 2 separate blood tests showing consistently low levels. You must understand, this is medical treatment for a condition called hypogonadism, not a shortcut for muscle growth or an anti-aging hack. So, the path to TRT has 2 requirements: confirmed symptoms hurting your life and the blood work that proves it. Both are necessary. If you do qualify, what change can you expect? The main goal is restoring testosterone to a healthy range and reversing the symptoms. How does it work? TRT directly stimulates protein synthesis, which is why men on treatment see real improvements in muscle mass and strength. The effects aren't just physical. It plays a part in brain chemistry, improving mood and focus. But with these powerful benefits, what are the hidden risks? Past the immediate symptoms, some research points to long-term protective effects. Properly managed TRT may help guard against certain age-related conditions. Specifically, evidence suggests a link between normal testosterone levels and reduced risk factors for heart disease and even dementia, though this is still being studied. So, the why of TRT isn't just about libido. It is about restoring a basic hormonal balance for your overall well-being and potential long-term health. Okay, you're diagnosed and you see the benefits. How is it actually administered? Australia offers several modern options for different lifestyles. Common methods are injections, short or long-acting, and daily applications like gels, sprays, or patches. Each has different costs and convenience. Let's talk numbers. The total annual cost is between $1,650 and $2,600. This covers fees, medication, and required blood tests. Medication costs vary. Injections are generally cheaper, around $40 to $100 per month. Gels and creams are pricier, at $80 to $120. So, treatment is flexible, but it is a significant and ongoing financial commitment. This is a long-term therapy, not a quick fix. Earlier we asked about the risks. Now we must face them. TRT is a powerful medicine, and that power comes with serious potential side effects. The primary areas of concern are your prostate, your fertility, and your cardiovascular health. These all demand careful thought and monitoring. TRT can speed up the growth of existing prostate cancers. For this reason, men with known or suspected prostate cancer cannot receive TRT. This is vital for younger men. TRT tells your body to halt its own testosterone production. This also shuts down sperm creation, which can cause infertility. The heart disease link is complicated. While normal levels may be protective, pushing levels too high can thicken the blood, potentially raising cardiovascular risk. Because of these risks, TRT is not a set-and-forget treatment. It demands regular blood tests and PSA checks for prostate health to stay safe. So, we have major benefits on one side and serious risks on the other. How do you weigh these to make the right choice for your situation? Recall the diagnostic gap from the start, the 5 versus 8 to 12 NMOL-LL levels. This is why it exists. The strict criteria aim to treat only men with a clear medical need. TRT is not about chasing a number. It's a doctor-guided process to relieve debilitating symptoms. The risks are only acceptable for a man whose quality of life is very poor. Your personal situation is the key. Your age, your desire for children, and any pre-existing health conditions will all shape the talk with your doctor. In the end, the decision to begin TRT is a balanced partnership between a well-informed patient and a knowledgeable physician. So, when should you seek TRT? When you have clear symptoms, a clinical diagnosis, and have fully discussed the risks and benefits with your doctor. Know the symptoms, insist on proper blood work, understand it is a medical treatment, and be prepared for the costs and continuous monitoring. If this sounds like you, your first step is not a specialty clinic. It's a conversation with your general practitioner. Discuss your symptoms and ask for blood work. Taking control of your health begins with clear information. You now have the framework to have an intelligent discussion and make the right decision for your health.